Good morning. My name is Lorraine Meadows. I'm Head of Service for the Improving Immunisation Uptake team. It's a real pleasure being part of the Institute of Health Visiting's Leadership Conference today. The aim of our session is strategies for improving child immunisation uptake. So our overall aim of our session is, I'll tell you about who we are and what we do, the Improving Immunisation Uptake team, strategies to improve uptake and successes, and challenges for parents. Next slide, please. I wanted to start the session by actually saying really how important child immunisations are and how key they are to maintaining health, and actually, you know, protecting individuals, not just individuals, but populations, preventing outbreaks. And those diseases can be absolutely devastating, and vaccines do save lives. And actually, you know, we're looking at 2 to 3 million lives saved each year. And health visitors and the health visiting service have an absolute key role to play in promoting child immunisations. Next slide, please. So the Improving Immunisation Uptake team, who are we? We're a service actually that started down in the Thames Valley back in 2018, and actually we're a service with the aim of reducing variation in uptake. You know, why will some practices have a much higher uptake and some practices have a lower uptake? So we're actually a service that's commissioned by NHSEI. We sit within CHIS, Child Health Information Service. We're actually a specialist team that sits within SEW CHIS. We're supporting primary care and other stakeholders. Health Visiting Service, we work closely with the Health Visiting Service and other stakeholders, CCGs, but also we support families, parents and families too. Thank you. Next slide. What do we actually do? Actually, we look at the data first, and the data for us has been absolutely key. And you know, there's lots of talk around data and accuracy of data. So we review that data first. You know, how accurate is that data? We provide direct support and facilitate, you know, whole practice approach when we're working with GP surgeries. So we're utilising primary care data to target those lower performing surgeries and practices across the Thames Valley. And actually we provide those practices with, when we talk about trackers and reports, it's actually showing them what their uptake is looking like. And actually we find that that can be really motivating once we're working with practices, that if they have those regular updates, they can see the improvements that have been made, and actually all those improvements are making a difference to their uptake, which is fantastic. So looking at processes, practice processes, and putting action plans and in place, and then monitoring. Data cleansing is absolutely key. So we share data with practices, you know, the data from Child Health, and actually compare the data with GP practices. And actually then we share that data with commissioners, and obviously we can escalate any concerns. But the key thing is actually working in partnership, not only with primary care, but those other stakeholders, looking at that local population. We can also provide resources and training, and actually the IIU team consists of clinicians and also data manager too. And actually I think that's been key to our success, because our data managers in our team are really so expert on the data, and actually then we've got clinicians in the team who can support with the clinical aspect. Next slide, please. So we talk about a whole practice approach, or whole team approach, whole service approach, and we feel that that is really important. So actually working collaboratively together in a coordinated fashion, but actually leadership is absolutely key. So, you know, who is the key person that's coordinating the immunisation programme? And actually within GP surgeries, they all now have immunisation leads, so they will be providing leadership leadership. So that's leadership, coordination, support, and obviously the administrative staff are really key too, because a lot of those processes around the data are administrative. So within practices, it's having that coordinated approach between the clinicians within the practice and also the administrative staff. And when we talk about whole practice approach, all individuals in practices have key roles to play, whether it be with the reception staff who are booking appointments, immunisation appointments, whether it's back office staff who are coding on immunisations, and whether it's the clinical staff who are actually delivering those immunisations and following up perhaps those non-attenders. Next slide, please. So what are the key issues that are impacting on child immunisation uptake? Well, children not up to date with the UK schedule. Lots of areas, across the UK have transient populations maybe that are living part of the time in the UK and abroad, or lots of children moving into the UK. And schedules worldwide are all different. So not up to date with the UK system. And ghost patients, lots of ghost patients on the system. Families move abroad, but they don't inform the GP practice that they've gone. And actually, when you think about it, is there any comms out there saying to families or patients, if you move abroad, make sure you tell your GP practice? And we are aware there are millions of patients who are registered at GP practices who are no longer in the UK. The other really important factor is, when vaccinations are either given too early or out of schedule. And, in different countries, schedules are different. So say like in Pakistan, they often give MMR at 9 months of age, whereas in the UK, for doses to be valid, they need to be given on or after the first year of age. So that's 2 doses. So vaccinations given out of schedule. Missing IMS histories are another really key factor. Families move in from abroad and they don't actually appreciate how important it is for their GP practice and health visitor team to actually have the immunisation history. And actually, if the history isn't there and the history doesn't get added to the systems, whether it be at child health or the GP practice, then it's assumed that those children aren't vaccinated. And yet actually, in the majority of cases, those children are vaccinated. So it's really key that there's a robust process in place for actually getting those immunisation histories. And actually, we have to make it easy for parents, sending through immunisation histories. I say to practices, they don't have to do it in person. Families are very happy to take photos of immunisation histories and email it through to practices. Other factors that are really key are availability of appointments, and not just the availability of appointments, but are there sufficient appointments for the need within the practice, and convenience of those appointments too. We're well aware that actually it's the preschool booster that has the lowest uptake when you consider the primary, the 1 year, and the preschool immunisations. And often parents talk about actually it's the convenience of being able to take their children. They want their children vaccinated, but they need to be able to go after work or weekends, evenings. So convenience of appointments is absolutely key. And I think the final factor on this slide is actually following up those DNAs, those non-attenders, or those that aren't booking appointments. And in most areas, Child Health are sending out reminder letters to parents saying immunisations are due, but actually if they don't follow up and book those appointments, then it's really key for practices and also the health visitor service to follow those families up. Lovely. Next slide, please. As far as the improving immunisation uptake service, just to say we started off as a pilot in the first year, and actually we had a significant impact across the Thames Valley, which we were absolutely delighted about. And so in fact the following year we were made a permanent service across the Thames Valley, and this was the impact of our service. So on the left hand side of the screen there we can see lots of red areas. That was April 2018, before our service came in post. And then in fact, September 20, when our service was made permanent, you can see there's already green areas and amber areas, which for us was absolutely fantastic because, you know, IMS rates were improving and increasing. And actually we're only a very tiny team, you know, one and a half clinicians and a full-time data administrator. So it was really thrilling for us that we had such a great impact. Lovely. Next slide, please. I wanted to talk today a bit about vaccine hesitancy. Because we hear a lot, don't we, about anti-vaxxers and lots of myths and lots of misinformation, I suppose, out there now on social media about vaccinations, and and it can be a real conflict for parents. But actually, back in 2019, the World Health Organization named vaccine hesitancy as one of the top 10 threats to health, and the reason, when you looked at why that was, or what were the reasons for the hesitancy. It was around complacency, perhaps parents not realizing how serious the illnesses are. We don't tend to come across, some of those illnesses very often now, so they're not so familiar to parents. The big key factor, though, was the inconvenience in accessing immunisations and those actual vaccines. But also there was that lack of confidence too. And I think that's where, certainly the health visitor service is absolutely key, in raising the confidence in the child immunisation programme. And as far as vaccine hesitancy, as I say, be open and encourage discussions regarding vaccine hesitancy. Parents have queries, they have questions, and actually they're not sure where to go to get those questions answered. So, as I say, health visitors are in that absolutely ideal position. A really wonderful website, fantastic website to refer families to, because we can't be expected to know absolutely everything. And so you can refer families, and the vaccine, Oxford Vaccine Group, which is based in Oxford, have got a really fantastic site called Vaccine Knowledge, and it's set up for parents, but it was also really useful for professionals too. And the sort of things on like ingredients, is 4 injections too many for my child. It covers all those topics that parents really do have questions about. What are the side effects? What are the ingredients? That type of thing. So the Oxford Vaccine Group is a fantastic website. Also respect parents' wishes. You discuss the immunisations, and if after that clinical discussion they've decided that they're not having the vaccination at the moment, always remind parents that the door is always open, and actually they can change their mind at any time. And I find that often with parents, they may be hesitant to begin with, but then they may change their mind as time goes on. And one thing that's really, really key about parents, what do we know about parents, is that they like to get information from health professionals, and they trust health professionals. So as health visitors, you have a really, really important role to play. And there's lots of evidence that actually by using that word recommendation in those discussions with parents, that actually that's a very powerful word. And so try and use that word recommendation in those conversations with parents. Thank you. Next slide, please. So let's have a look and see what challenges parents face. And I think those challenges have increased, with the pandemic, and surgeries are working in very different ways, and health visitor services is, we're all having to adapt, aren't we, to the pandemic. So looking at, the challenges parents face. Well, I suppose first of all, it's actually booking those appointments, and actually it's a real challenge to get through to GP surgeries. And I know I often ring GP surgeries, and I can be in a queue of sometimes 15 or 20, and so when you're ringing the GP surgery, it can take a very long time to get through. And have parents got that time to hold on to, wait for the call to be answered? So that is a real big problem for parents at the moment. Where to go for advice, because a lot of parents think, oh yeah, I book an appointment with the practice nurse when I want the immunisations, but they're not actually aware that they can go and have discussions around immunisations. And also, as I say, the health visiting service is absolutely key to this. So having some tools in your toolkit, like being able to refer parents to that vaccine knowledge site, it's a site that parents really like. So we've talked about that, actually the contacting of the parent, the surgeries, how difficult it is, but actually booking those appointments that might be convenient for parents. Parents are working, parents are under extreme pressure and challenge. You've got parents working 0 hours contracts. When can they go? They want the appointments, but they need to be able to get those accessible appointments. And actually, we always say with GP systems, it's really important to have appointments ahead that they can book. So when parents come in for the 8-week immunisations, to make sure they've got an appointment for the 12-week IMS before they leave. And that cuts down the number of phone calls, and the evidence shows parents are much more likely to turn up if they've actually got an appointment. And also timely immunisations, and that's all tied into the availability of and the ease of booking appointments, because actually we want the children and the babies to get those vaccinations at the time that's specified, and so they have the optimum protection. And sometimes I find appointments are booked up quite a few weeks ahead, and actually because of that there's a much higher chance of DNAs too. So actually ensuring there's timely appointments available is really, really key. Thank you. Next slide, please. So how do we work with parents? How do the health visitors, or how do we recommend working with parents to improve immunisation uptake rates? Next, please. Yeah. One of the really key things is reminding parents actually to register their baby, those newborn babies, with the GP surgery. Some parents aren't actually aware that they need to do that. And certainly across the Thames Valley, when we look at when babies are being registered at GP practices, it's around 50% are registered by 8 weeks of age. And actually, if those babies aren't registered, it can then delay their ability to have book appointments and things. So when health visitors are in contact at the primary birth visit, reminding parents to get those babies registered at the GP surgery is really, really an important factor. Thank you. Next one. Make every contact count. So, if you're in contact with parents, perhaps, clinics, health reviews, ensure that all the skill mix within teams have really got immunisations as their focus. If you're following up A&E attendances, make every contact count and raise immunisations. And actually, see if you're seeing a mum with say a baby, quite a small baby, think about those older children, those preschoolers that are also due, say, flu vaccination and their preschool boosters. So think about that whole family approach. Lovely. Next slide, please. Or next, yeah. And make the illnesses and vaccines relevant to parents. And I think, the focus is very much on the immunisations and the actual vaccines and what the side effects are, and possibly, is there going to be any reaction, and are the babies well enough to have their vaccinations? And sometimes, I feel, it's really useful to talk about the illnesses and actually what illnesses the vaccines protect against. And one of the cases I often talk about is, rotavirus vaccination. And actually, before rotavirus vaccination, that protects against diarrhea and vomiting. And actually, before rotavirus came part of the child immunisation programme, the major reason for admission for the 0 to 1s to hospital, and often being really very unwell, was diarrhea and vomiting. And actually, since rotavirus, as I say, became part of the schedule, that just rarely happens now in the 0 to 1 age group. And so that, is a real success story. And so it's really trying to make those illnesses relevant to parents, saying how pneumococcal vaccination prevents those chestiness and chest infections, and I think it's more likely to sort of hook parents in if they know more about the illnesses. Lovely. Next one. Transfers in. Obviously health visitors have a really key role to play, because particularly those families, say, coming in from abroad, you're having those contacts with families, and I do appreciate they're not all face to face now. Some are virtual, some are by phone, but that's that key contact, and to talk about immunisations and actually help parents, particularly if they're coming in from other countries, why it's important, or why schedules are different in different countries, because there are different circulating diseases, and that's why schedules can be different too. So transfers in, that's a really key time, an important time. Next point, please. Translation tools. There's some really, there's a couple of very good translation tools now to aid in the translation of immunisation histories. What was Public Health England? They've got a really good tool that can help with the translation of the top 20 countries families come from, and that can be really helpful in deciphering those immunisation histories. And also the World Health Organization, they have a global summary, so they have immunisation histories for every single country, so you can also refer to that. So that will help in considering if what immunisations are missing from the UK schedule. Lovely. Next point, please. And what if there is an uncertain history? I mean, we do know lots of families are coming in from abroad. They haven't actually got paper copies of the immunisation history. And certainly the guidance is that if parents actually can give a reliable verbal history, then actually we can use best guess dates, because a lot of those parents, if their children are up to date with the country they've come from, their home country, they don't actually want schedules completely starting again. And so actually uncertain history, if they can give a good verbal history, and you can look at the World Health Organization immunisation schedule, then best guess dates can be used, going by the child's age, obviously, and date of birth. But actually, if it's really uncertain and the parents are unsure, then the advice is to start again. And there's absolutely no risk in starting immunisation schedules again, and there's no risk of babies and children getting over immunised. It's much better that they're protected than not. Next point, please. Liaison's absolutely key. Health visitor team, GP practice nurses, and there are safeguarding leads within GP practices. And I always recommend, say, do liaise with the health visiting service when children aren't up to date with vaccinations, or there's been multiple DNAs. There might be quite a lot of complexity going on, and it's just good for those good communications to be going on between services. Next point, please. On health visitor records, we say, then flag. I mean, I do appreciate you've got the health visitors who have got their key contacts, but actually if you flag on the system that, or on their records, that immunisations aren't up to date, then when you've got your next key contact, whoever's going to be seeing that family will be aware that immunisations aren't up to date, and actually can raise that with the families. Next point, please. We've talked about vaccine knowledge, and it's really good if you've got an iPhone, iPad, to download it on there, and then you can share it with parents. A fantastic site. Lovely. Next slide, please. So if you want to find out more, then please do contact our team. We can tell you more about how we've been working across the Thames Valley, or you can contact us by email, sewcsu.improvingimsuptake@nhs.net, or you can call on 0300 561 1855. Thank you.